From now, City Club is hosting a gubernatorial debate between Democratic candidate Ted Kulingowski and Republican candidate Ron Saxton. Reservations are highly recommended for this Friday forum and may be made by calling City Club or by going online. Details about these events and many other programs and membership can be found in your bulletin or online at www.pdxcityclub.org. We have a new member today of City Club who I would like to introduce and have her stand, and would you please join me in welcoming her to City Club. Her name is Sarah Nashif. Sarah, could you stand? She's back there. We have great corporate citizens in Portland who help make these programs possible. We have just started a new quarter with two new corporate sponsors for the quarter, and they are Barron Liebman LLP and Zimmer Gunsel Frasca Partnership. Could you please join me in thanking them? Today's forum is a discussion of ballot measure 43, which would change the law in Oregon regarding parental notification for minors seeking an abortion. I would like to introduce our panelists and our moderator. On my immediate right is Dr. Liz Newhall. Dr. Newhall is a founding member of Every Woman's Health at Emanuel Legacy Hospital. Over the years, Dr. Newhall has delivered thousands of babies and performed thousands of abortions. Dr. Newhall has maintained a professional interest in teen medicine since her first teen clinic in 1984. She was a plaintiff in the 2001 case of Planned Parenthood of Columbia Willamette, Inc. versus American Coalition of Life Activists, which was also referred to as the Deadly Dozen case. She has performed research on medical abortion with drug RU-486 with the Oregon Health and Science University, and was a clinical presenter before the Food and Drug Administration concerning medical abortion. She's the mother of 3 wonderful children. She was raised as a Catholic and came to her views on abortion medicine through her experience in women's medicine over her 30-year-plus career. At the end of the table is Grace Powers. Grace Powers currently lives in Roseburg, Oregon, with her husband Larry, where they have lived for 15 years. They are enjoying their 26 years of marriage and are deeply grateful for their 5 children ranging in age from 26 to 15. Grace is also the proud grandmother of a 1-year-old grandson. She currently works on staff at the Roseburg Christian Fellowship, and she's also active in the lives of high school students at Roseburg Christian Fellowship. In her free time, she enjoys reading, painting, and get this, snowboarding. She is a grandmother who snowboards and skateboards. In the middle is Dr. Melody Rose. Melody Rose teaches American government and politics at the Hatfield School of Government at Portland State University. She has authored a number of articles and book chapters on social and election policy. Most recently, she is the author of a book evaluating American abortion policy entitled Safe, Legal, and Unavailable. Dr. Rose is the program director of New Leadership Oregon, which offers political and leadership training programs to college women in Oregon. She has served on the board of directors for the Classroom Law Project, and she is on the Friday Forum Committee of the Portland City Club. She lives in Portland with her husband and their 4 children. Our moderator today is on my left, Nick Fish. Nick is a partner in the law firm of Meyer & Wise, LLP. He specializes in labor and employment law. His volunteer community service includes the College of Urban and Public Affairs at Portland State University, Volunteers of America, Oregon, and the Campaign for Equal Justice. Nick also serves as host of Outlook Portland with Nick Fish on KRCW, right? Okay. So Nick, I'll turn it over to you.
Thank you very much. I would like to just review the ground rules with the audience and with our panelists. Each panelist will have 7 minutes to make an opening statement. Chris Smith will be serving as the timekeeper and enforcer. After opening statements, there will be a first question from the City Club sponsor, and then we will have a 15-minute Q&A period, which I will facilitate, trying to make sure, excuse me, that each panelist gets a fair allocation of time and questions. At the conclusion of the 15 minutes, we'll open up questions to the floor. Our first speaker is Professor Melody Rose. Professor, you have 7 minutes, and you're on the clock. Welcome.
Thank you, Nick and Susan, for that generous introduction. Thank you also to my fellow panelists for joining me today, and especially thank you to City Club and the members of this organization who, without fail, face tough issues with equanimity and thoughtfulness. Thank you for having me here today. I might point out that there are a wide variety of opinions on the panel today, which should come as no surprise, but there is a lowest common denominator, which I discovered. Between us, the panelists have a total of 12 children, which means that although we may disagree on how best to care for kids in this particular policy area, clearly we all have experience with them and are individually working hard toward their welfare. A quick word on my role on today's panel. I have been asked specifically to provide a neutral overview of the history of parental involvement laws in America and to offer an explanation of Measure 43. In my prepared remarks, I offer no particular position on the measure. That job will be left to the other two panelists. Without further ado, in the landmark ruling of Roe v. Wade of 1973, the Supreme Court created a privacy right that extended to the issue of abortion. In the wake of that decision, states passed a number of restrictions in order to test the limits of that Roe holding. One of the first trends within that movement was the swift creation of parental involvement laws. By the mid-1970s, challenges to these new state provisions began to reach the Supreme Court for review. Between 1976 and 1990, the court issued a series of rulings that created guidelines for states that choose to limit minors' access to abortion. From these rulings, we can see three consistent legal principles emerge. First, reflecting an appreciation that not all girls have two loving and custodial parents, that states may not require a girl to involve both parents in her decision. A state may only require one parent's involvement. Second, the court has also argued that girls who wish to avoid notification or consent altogether must be offered a judicial alternative. Known as a bypass procedure, this judicial alternative typically involves an administrative law judge who hears a girl's request for abortion without parental involvement and makes a decision as to the girl's level of maturity as well as her best interest. Third, and most importantly, all major abortion rulings have consistently required that abortion restrictions of any kind must elevate a woman's health considerations above the interest of the given state in limiting abortion options. Even as recently as 2006, the court has reiterated this commitment to women's health over the state's right to limit abortion access. As a result of a national social movement, as well as the court's guidelines for parental involvement requirements, the vast majority of states today have adopted some type of limitation on minors' access to abortion. That required involvement, however, can take several forms. 21 states today require that one parent consent to a minor's abortion, while 12 states require prior notification of a parent. One state, the state of Utah, requires both consent and notification from one parent. 9 additional states have enacted parental involvement laws, though those laws are unenforceable because of state-level court rulings. 2 states, Connecticut and Maine, as well as the District of Columbia, explicitly allow minors to consent to their abortions. The remaining 5 states have no parental laws whatsoever. Oregon, of course, is among this small group. Measure 43 represents Oregon's latest version of a parental involvement requirement. As many of you in this room will remember, Oregon voters last defeated a parental involvement provision in 1990. Measure 43 is typical of other parental involvement laws in many ways, but it does have some particular features that distinguish it from others and requires some special explanation. In the state of Oregon, current law provides that all minors aged 15 and above are legally empowered to consent to medical treatment, any medical treatment, while minors 14 and below must have parental consent. In other words, minors in the state of Oregon aged 15 and above are considered medically emancipated in the state. Measure 43 would create a single exception to that rule by requiring that medical providers supply written notification to one parent through certified mail when their patient is aged 15, 16, or 17. That certified notification must be received 48 hours before the procedure. Alternatively, girls aged 15, 16, and 17 could seek out judicial relief from this requirement through a traditional bypass procedure by presenting her case to an administrative law judge. If the judge were to forbid the abortion, the girl would then be allowed to appeal that decision in district court. Failure to comply with this requirement would leave medical providers vulnerable to civil suit and administrative judgment. The measure does not create exceptions for instances of rape or incest, making it unlike many parental involvement laws in the nation. The measure does, however, create an exception for medical emergency. Finally, I will close with a few words on the scope and trends of abortion care, both in the state of Oregon and nationwide. The abortion rate in Oregon and across the nation has been declining for a number of years. Abortion rates for both teens and adults peaked in the 1980s and have been steadily declining along with the rate of unintended pregnancy as a result of better access to contraception and sex education. Here in Oregon, many of you have seen the numbers recently, illustrated in our local newspapers and on OPB. The Oregon Department of Human Services reports that in 2004, 618 girls aged 15, 16, and 17 had abortions in the state of Oregon. For their stories and the data on their experiences, I will yield now to my fellow panelists. Thank you.
Thank you, Professor Rose. And by prior agreement, the next speaker is Grace Powers of the Yes on 43 campaign. The microphone. The microphone died. Pronounce your last name for me.
Oh, great. I'm going to have a broken mic. Okay. Well, I too found some common ground with my fellow panelists. We have a skier and another fellow snowboarder, in addition to being moms. Well, thank you for allowing me to be here. It's an honor and a privilege to join you, and it is very difficult for me to speak about what happened to us, but I need to let you know why this law would have made a difference to me and my daughter and my family, and why it's important in the state of Oregon. My daughter had an abortion just after her 17th birthday without me or her father knowing about it. Unfortunately, our story has been repeated far too often in this state. I remember the day she had the abortion. She came home from school complaining of the flu, and she went immediately to her room for the night. For days, she said she felt sick and exhausted, and she remained completely withdrawn from her family. As the days and weeks went by, our daughter completely changed. Oh. Okay. As the days and weeks went by, our daughter completely changed. The girl who was once happy, productive, and energetic began slipping into a very frightening place. She began to show self-destructive behavior, and she was sinking into depression, trying to cope by using drugs and alcohol. She stopped seeing friends, and she pulled away from all of us in the family. We're a very active family, so it was quite noticeable. She barely attended school, and even though she was not a perfect child, we had never seen her act like this before. We didn't know what was wrong, and we didn't know how to help her. Then one day, her cousin came to our house, and she told us that our daughter had had an abortion, and now the news was spreading around the school. I was shocked at the news, thinking, she's under 18, there's no way that could have happened without me knowing. My first thoughts that flashed into my mind were that just prior to that, I had to be there when she got her ears pierced. I asked her why she didn't tell us, and she said it was because she didn't want to disappoint us. She felt like she had no other options. Her friend told her that having an abortion would be the easiest way to deal with it, and then the nurse and the employee at the clinic told her that it would be legal to have an abortion without us having to know. To her, at the time, it seemed like the only way to avoid dealing with her mistake. We assured her that we would have been there for her to support her no matter what, because that's what parents are for. Over the next several days, she relayed some very disturbing things to me. I was outraged at the system. I didn't understand how something like this could happen in our country. How was it that my daughter, months before her abortion, had to have my involvement to go on a field trip, to take an aspirin at school, or to have her ears pierced, yet something as medically significant as an abortion could be performed on her without me knowing about it? It didn't make sense to my husband and I. When my daughter started talking about the details, she explained that when she suspected she might be pregnant, she visited the school nurse. She was counseled to have a pregnancy test at Planned Parenthood, where counselors advised her to have a quick abortion. They told her she could have the abortion and that her father and I would never have to know. They guaranteed her that it was legal to keep it a secret from us. They put her on the fast track and didn't explain much about the paperwork, the procedure, or how to care for herself afterwards. The clerk at the abortion clinic assured her that the abortion would be paid for by the Oregon Health Plan, which my tax dollars paid for, and that she would have nothing to be concerned about. While she waited to sign her papers, she asked the woman at the counter if she had ever had an abortion. The woman told her that yes, she had, and it was a piece of cake. A perfect stranger was the final nudge that convinced my daughter that having an abortion was painless, easy, and would be kept a secret. As it turned out for my daughter, none of those things were true. Our daughter expressed to us that, in fact, it was not a good decision. It was a painful procedure, and although they gave her pain medication afterwards, there was no post-operative aftercare. There was nobody there for her to talk to once the decision was made. She didn't anticipate the enormous rush of emotions, the confusion, or the grief and shame she would experience afterward. Her conversation with the woman at the clinic was a real sticking point for my daughter, and that's why she's allowed me to share her story with you. She feels like she was very deceived. She's still shaken up over it, and it's been several years. She says, "Mom, I was scared. I didn't want to disappoint you or Dad. I was afraid of doing anything else. I didn't know where else to go." If we would have known about her decision, we could have been there to support her properly with love, medical care, and proper follow-up during her recovery period. But instead, she was left to treat herself, not understanding the emotional or physical risks involved with such a procedure. She has had many medical concerns since making her abortion decision. Parental notification for her would have taken the pressure off to make a rushed decision, and it would have been a good time for her to reflect. I don't know if my daughter would have made a different decision with us involved, but at the very least, she would have had the support of people who know her and who care about her. The day the news broke was the day she dropped out of high school. She was just 3 weeks from graduating. It took her 2 more years to finish high school, even though she's a really smart kid. My daughter is still experiencing deep grief and depression associated with this decision. This decision was made for her by people who didn't know her, who didn't love her, and who didn't care about her long-term emotional and physical health. If so, they would have been there to pick up the pieces afterwards, like we had to. For a teenage girl to have an abortion without the protection and wisdom of a loving parent simply doesn't make sense. Parental notification will put an end to a nonsensical loophole in the law. Our girls deserve the very best care and support, and quite honestly, right now they are left at the mercy of an unregulated and heartless process. The bill will give organ parents the chance to protect and support each and every daughter. Finally, I believe that moms and dads can and will step up to do what they've done all along. Parent their children well during the positive times, challenging times, and all the other times in between. We're very, very committed to fighting for the excellent care of our daughters in every aspect of their lives, and rest assured, we're going to do just fine, caring for our daughters during a crisis pregnancy if we're just given the chance. Thank you.
Thank you. Our third and final speaker is Dr. Liz Newhall of Every Woman's Health at Legacy Emanuel Hospital. Dr. Newhall.
On your mark, set, go. Grace, that was, I'm sorry for your family's difficulties, but I have to say I wouldn't be a very good doctor if I talked patients into making decisions that wasn't in concert with their heart. Thank you to the City Club for this opportunity to share my thoughts about a topic near and dear to my heart. I always talk fast. I'm not just trying to cram it all in here. How to tell you my heart in 7 minutes. Grace, I'm sure you felt the same way. I do have a handout in the back which has references to all the information that I'm about to present. Although I was raised Catholic, I began providing abortion services when I recognized the public health implication of barriers to this service, even those innocent enough, like Measure 43. Women have been having abortions as long as there have been women. So either women are bad, or abortion is a morally acceptable choice. Obviously, I vote with the women. Abortion would not have remained the public controversy that it is if there were an obvious right answer that could be uniformly applied. But the ramifications of the abortion decision are as varied as the individual women who seek them. Public policy must be fashioned accordingly. I am in complete agreement that supportive dialogue between parent and child about important issues is optimal, but I'm here to tell you why mandating dialogue is doomed to failure and bad medicine besides. Family communication will not be improved. Family violence will inevitably increase. All procedures will be delayed. Risks and costs will be increased. Bear in mind as I speak that my opinion conforms to that of all medical groups. The Oregon Medical Association, our physicians, the Nurses Association, the Teachers Association, the pediatricians, the American College of Obstetrics, everybody who's examined the data or works with teens opposes this measure. Even the Even the AMA, hardly a liberal bastion. What is the medical experience of the proponents of this measure? Facts. 618 teen abortions in Oregon last year. 50 to 90% by all measures already inform a parent, mostly their mother, who remains the most influential person in the adolescent's decision. The younger the teen, the more likely she is to tell her mother. So this measure will affect about 200 teens at most, half of whom are 17. But among these 200 are the teens with the most complex health care needs, like the one who watched her sister get beat up and kicked out when her dad discovered her pregnancy, like the one impregnated by her stepdad whose mother doesn't believe her, like Caitlin Kempf, the 19-year-old honors student whose parents abducted her bound hands and feet to force her to have an abortion, as if any doctor would perform an abortion under these circumstances. I myself have let a young woman out the back door of my office who wanted to continue her pregnancy while her father made a scene in the waiting room. demanding she have an abortion. So consider these girls while you think about this measure. For comparison, there are 300,000 kids annually removed from their homes in the U.S. every year for their own safety, 70,000 of them permanently. There are 6,000 cases of child abuse reported last year in Oregon. There are 120,000 kids in Oregon without health insurance, and Monday's Oregonian reported 24,000 homeless kids in Oregon. You know that among them are some of these 200 kids. Where am I supposed to go for parents? We could have helped a lot of homeless teens and a lot of abused youth with the millions of dollars that both sides are spending on this campaign. Physicians already report child abuse when we suspect it. I have had to call the police more than once to my office to arrest a step-parent who impregnated my patient. None of them have proved innocent. But if only it stopped there. I have also many grown women in my practice who actually change consciousness or disassociate when they have pelvic exams, if they even come to the office to get them. These are consequences of childhood sexual abuse. Some of them are permanently disabled. I've seen the scars of cigarette burns and head trauma, more than you want to hear about. Do you think those parents are going to dialogue well? I don't need any more stories to know that all homes are not safe and all parents are not kind. Do you? Okay, the data. Let's look at this methodologically. For Measure 43 to be a good idea, at least one of the following three tenets must be true. Number one, that abortion carries a high risk of psychological or physical harm. Not true. Number two, that teenagers are not competent to make informed decisions. Also not true. Or three, that parental involvement is always helpful. I've always spoken to this, but I have more data. Number one, what's the risk of medical or psychological harm? Abortion is way safer than birth. CDC data from 1997 gives the birth mortality at 9.2 maternal deaths per 100,000 women, which is about 1 in 10,850. The death rate from surgical abortion, 1 in 333,000, currently estimated at about 1 in a million for early surgical abortion. So, physically at least, we can agree it's safe. So here's the question. How does it affect our daughters if they have an abortion? Assuming they can pay for it, assuming they can get to one of the 13 counties that provide services without telling us. The literature tells us that the risk of psychological harm to these young women is low. The rates of distress and dysfunction are lower after an abortion than before. Studies of note, 442 patients followed 2 years after an abortion showed a lower incidence of post-traumatic stress than the general population. 360 women entered into a study teens of course, when they sought a pregnancy test, were followed for 2 years. After 2 years, the abortion patients were functioning as well, or even better than those who had a negative test or who carried their pregnancies. They had less anxiety. They were more likely to have graduated high school. They were less likely to have another pregnancy. The only group who did not fare as well psychologically were teens that had been forced to tell their parents. 30 seconds. Certainly these data do not suggest that there's a psychological harm. I found 70 cases of quinine poisoning with 11 maternal deaths. 60% of teens that said they would change their healthcare practices. So, in closing, if doctors, nurses, teachers, and pediatricians are opposed to this, shouldn't Oregonians consider their opinion? We can do better. I was the doctor waiting to treat Spring Adams, the young woman who never arrived. The middle ground is healthcare, contraception, and conversation, not a one-size-fits-all law brought to you by those whose real agenda is making abortion illegal. We should be proud of our state's enviable record on women's health care. And I repeat, if even one girl gets hurt, which is inevitable if this measure passes, we will all hang our heads in shame. If teenagers lose their right to confidential health care, they're not going to come in for STDs, and they're not going to come in for birth control. Here's what teens can consent for. They can be tried as adults at 16, even though this group of kids has a higher incidence of mental health disorders. They can have a baby without telling us, and they can put it up for adoption without telling us. I urge you, be on the side of good health care. Let's look at the data and vote no on Measure 43. Thank you.
Thank you, Dr. Newhall. We now are going to move to the Q&A portion, and we have 15 minutes allotted, and I'd like to ask our distinguished panelists to try to keep their responses to about 2 minutes if possible. The first question is for Professor Melody Rose. 44 states have adopted either parental notification or parental consent laws, and the Supreme Court has held that these are generally consistent with the Roe v. Wade framework. My question is, isn't Oregon bucking an emerging national consensus in favor of parental involvement in a minor's decision to have an abortion?
That's a great question, Nick. I have a few thoughts on that. One is to consider the role of majorities in American political thought and institutions. There are plenty of times in American history that we can think about in retrospect where the majority was wrong. So the fact that we have a majority on any public policy, this one or any other, does not, in my mind, necessarily mean that it's good public policy or that it's morally right. So to me, that would be the first question that I would ask the audience to consider in their own hearts. The other issue, I think, around this is that I think one of the reasons that a majority of states, I wouldn't call it a consensus, but a majority of states have accepted parental involvement requirements is that intuitively they have appeal. Intuitively, they make sense to moderate, well-meaning, caring people. Who among us doesn't want girls to talk to their parents? So on the face of it, I think that the organizations that are behind parental involvement requirements have, in some ways, an easier sell in their messaging than those who have to oppose these requirements. Think about the way in which those who oppose these requirements need to slog through data in order to establish and vet their cases. In some ways, it's a different exercise. Those who oppose must look at medical data, sort of arcane philosophies of governance, and I think it's a harder sell to put no on a bumper sticker.
Thank you very much. My next question is for Grace Powers. Measure 43 requires minors who are victims of rape or incest to obtain judicial approval for an abortion. My question is, why do you believe an administrative law judge is better equipped than a medical doctor to make this determination?
I think that's a great question. Most people think that when a girl goes in for an abortion, she's going to her primary care physician. That's not true. She's going to a perfect stranger. She doesn't know this person who's about to perform an abortion. In the case of my daughter, she was on the fast track for an abortion, so she didn't even have time to think. It was within a period of 4 days from the time she found out she was pregnant until she found out she was pregnant and she was having an abortion. I believe that an administrative law judge, if she would have chosen to exercise the bypass, would have been no different than a doctor in terms of stranger factor, but that person would have been able to ask her more questions, spend more time with her, and determine it based on maturity and what's in the best interest of her. I think it would have been a good break for her.
Thank you. Dr. Newhall. A 15-year-old girl in the state of Oregon cannot vote, cannot marry, cannot drive a car, a 15-year-old girl, cannot serve in the military, and cannot purchase alcohol. Why do you believe that a 15-year-old girl has the emotional maturity to make an informed decision to have an abortion when by law she can't vote, drink, serve in the military, marry, or drive?
Oh, that's one of the parts of my speech I didn't get to, so thank you very much. Lastly, but firstly, I would like to say that every single physician in this state who receives an abortion does meet with a physician, and it's a failure of our healthcare system that they don't see their own personal physician, and that abortion care has been marginalized into clinics instead of being cared for by gynecologists in the mainstream. But in terms of a 15-year-old, well, they can drive at 15 and a half, and they do drive earlier than that, as you know. But the question is, how well do they make decisions? So researchers looked at, compared teens to adults, young teens, older teens. They looked at their ability to repeat back to them the risks and the benefits. They looked to repeat back to them the voluntary nature of the decision, you name it. The only differences between teens 14, 15, and those 16 and 17 and those of adults was that the youngest adolescents who were 15 and decided to carry their term showed a lower ability to make quality decisions than older teens. 15-year-olds did not differ from 21-year-olds in terms of their ability to understand the consequences of their decision or the implications. The fact is, the average age of first period when the country was founded, 12.8. Average age of 16, screwing this up, was 16. They got married, they had kids, they were 16. Now a young woman becomes sexually mature at 12 and socially mature sometime around 25 or 30. It keeps going up. The point is, kids are sexually mature much younger than they are socially mature. And I would agree. I'd much rather have them not drive at 16, but that's not up to me. My point is they deserve health care. And the research around healthcare suggests that they are able to make this decision, understand the implications of this decision, and that it does not traumatize them medically or psychologically.
Thank you. Professor Rose, can we go back to the national scene for a moment? And can you tell us, is there any hard data or evidence that's out there that tells us whether these parental notification laws have been successful in meeting their stated objective of promoting better family communication and teen health and safety?
The short answer, is this on? The short answer to that question is no. There is no hard data offered up by independent scholars that would prove that parental notification requirements improve family communication. And frankly, as a scholar myself, I'm not even sure what the study would look like that would allow us to measure something so intimate, so variable, so unique to the family that we would be able to know the answer to that question. What we do know, however, is quite clear. What we do know from the other states, as you've noticed, the vast majority of states, is quite a bit. These state laws have been on the books now for 10, 20, and 30 years, and data is rolling in fairly steadily from respectable scholars, which illustrates that in survey after survey after survey, girls report that if they have to face a parental involvement requirement, they very may well circumvent the law. And that, I think, is something that is consistent across the studies. These studies are not offered by the interest groups on either side of the question. They're by scholars who have no vested interest really in the political outcome of this question. So on that side, I think the data are quite clear, and I think that we have to think carefully about where the data lie, which information we know and which information we simply don't, or even can't if we wanted to.
Thank you. Grace Powers, current Oregon law permits a minor age 15 to 17 to consent to any surgical procedure, and no notice must be given to a parent or to a guardian. Thus, a 15-year-old girl can consent to cancer treatment, heart surgery, even to the delivery of a baby. Under Measure 43, there is only one procedure which is singled out for parental notice, and that's an abortion. My question is, why didn't the crafters of Measure 43 simply repeal Oregon law, which gives minors 15 years or older the right to consent to any medical treatment without parental consent, rather than single out one procedure, and that being abortion?
Well, I think because for practical purposes, there isn't a pediatrician or an internal medical person who would allow a 15-year-old to have a medical procedure without pulling the parent in. That's not the practice. Insurance companies don't pay claims that parents don't know about. Our system isn't based on that. So the current practice is that even if it is a law that 15-year-olds don't have to have parental consent, that's the way it works.
Thank you. I think we have time for one more question, and it will go to Dr. Newhall. Under current law, a 14-year-old cannot consent to have an abortion, but a 15-year-old can consent. Can you help us understand how this line has been drawn between the rights of 14-year-olds and 15-year-olds, and do you think it's a valid demarcation?
Again, with medical issues, biologic phenomenon, the lines are always gray. But in public policy, you have to draw a line, and so we do. The fact is the data doesn't differ really much in terms of 14, 15, 16, 17-year-olds in terms of their ability to make decisions. But vis-a-vis whether or not we provide care without their parents, knowing a kid's got to pay for their care. So in order to have confidential health care, a kid's got to be able to pay for it and not include their parents. So I submit that I take my medical judgment from the literature, which is uniformly supportive of teenagers' ability to make their own health care decisions. And the reason 50 states say that kids can consent for STD treatment, for example, is because we know they won't come in if they think their parents are going to be involved. These teenagers are not kids and they're not grown-ups, but at some level they have privacy rights, HIPAA rights. It's weird to me that we're compelling the speech of our daughters. It's weird to me that we have different standards of consent and health care for girls and not boys. So yes, we can all sit down together and decide, but I submit to you that these lines were drawn in order to protect the health of our teenagers, the health of our children, not in order to spite the parents. We're not, we're here, our agenda is your daughter's health.
Thank you very much, and now I'm going to turn the program over to Susan Hammer.
Our first question today will be asked by board host Tamsin Wazell. Tamsin is secretary of the Board of Governors of City Club. She is an organizational development specialist, and she is former chair of the City Club Research Board. Tamsin.
Thank you. Most of you know that standing up won't make much difference, and besides, I'm terrified of that microphone at this point, so I'll just be sitting here asking the question. I have to say that as the course of this debate went on, I got more confused about what this measure is about. And my confusion comes in, and this is where my question is this about prohibiting abortion, or is this about parental notification? And Grace told, and I'm going to point this probably a little bit towards Grace, but a very touching story of interaction with her daughter, and I'm thinking, well, couldn't that same story have been told about a young boy who had a sexually transmitted disease, had AIDS, had any of those things? And if this law, and this is my question, is this law about parental notification and caring for our teens, or is this an anti-abortion law? Because if it's a parental notification law, what about the boys?
I think that's a great question. Parental notification is not about abortion. Like I said, I don't know what my daughter would have done had I have been notified. It's about parents knowing what is happening in the lives of their children and being able to be there to support them when something happens that is beyond their control. And I don't think it's about mandating communication. That was mentioned. It's not about that at all. It's about parents being informed of what's happening in the lives of their kids.
Thank you. We now move to the point where members of City Club are allowed to ask a question. Questions in this context take 30 seconds or less. They are not a speech, and they end with a question mark. And if you'd like to say who you would like your question to be directed to, that might be helpful. Thanks.
Kurt Wavering, member. To any of the participants there. I understand from what you said that a parental notification law is likely to lead to circumvention of the law. What I'm concerned about is, and we have data in the draft report that's coming to the City Club about this, about abortions, but those are in clinics and by medical people. What about the issue of non-medical abortions, going to Mexico, things like that? Because it used to be that there was data about deaths and things like that from such such procedures.
I'll address that. If you look at the maternal mortality curve, starting at 1900, running out until the present day, and it's just a graph of the numbers of women, the rate of maternal mortality, the last drop that's visible as a jag down on the curve was in 1973 when abortion was legalized in this country.
Justin Gottlieb, City Club member. This is a question for Grace. I was struck by your question on children in schools, you as a parent being notified of taking Tylenol. How can we expect our children, when we don't allow them to make minor medical decisions, make major ones? Shouldn't we be actually asking the question of parental notification on the major decisions while allowing some self-decision on the minor ones?
Yes, I agree. I think that for my 17-year-old, as a senior in high school, she should have been able to make a decision whether or not she needed an aspirin. But the way it works is that they're not allowing kids to do that. So I think there's balance, and there's got to be a reasonable logic to it. But an abortion is a huge medical procedure. It's very invasive, and there are things that do happen psychologically. I know that Dr. Newhall doesn't believe there is, but there is. I've spoken to lots of girls who have had some long-term effects associated with the abortions they had when they were in their teens. And I read a long time ago when I was a young mother about teenagers and the mentality of teenagers. I don't know how many people here have teenagers, but raising 5, I see this as truth. Teenagers can be like toddlers in their decision-making process. Some of the things they do are so dumb. They don't know why they do it, and then you ask them, I don't know. Teenagers are great, they're awesome, but when it comes to a serious situation, I don't know that they're equipped to make that alone without their parent. And I think I'm the best person, not necessarily a doctor or a person who works at a clinic, to help guide that decision.
Number one, if they're toddlers, why do we let them drive? Number two, they can't get aspirin in school because of liability from the school, not because it's dangerous. Number three, 12,000 cases of death from ibuprofen last year, and not even a fraction of that from abortion.
Doug Fashing, a City Club member. This question is for Melody Rose. I'm wondering, setting aside the data, what would you want for your own daughter?
Oh, that was the question I was hoping I wouldn't get. Well, first let me say as a disclaimer that I wasn't asked to speak on this panel because of my superior mothering skills. But so I will try to give you the wonky answer to that. I will try to give you the policy-based answer to that question. As I mentioned, we all have a lot of kids on this panel. I have 4. 3 of them are daughters. 1 of them is a teenager. Based upon the data and the research that I've scrutinized, I would say that the first step in that long road, hopefully toward avoiding an abortion at a teenage, in the teen years, would suggest that my daughter would be all along getting good sex education, that she would have access to contraception, and frankly, that I would be a responsible and loving and open and consistent parent throughout her childhood. So in talking to my kids, I hope that the work that I've done as a parent and the work my husband has done as a parent will, I hope, prevent us from being in that situation in the first place. That's what the data tells us is the best prevention. Now, that being said, even when you're the best parent you can be, which I trust that Grace is, I certainly don't distrust her intentions at all. These things happen to our children. So what I would hope, again, based upon the data, would be that I would know. I hope that I would know. But there is a possibility that I wouldn't. And in that case, based upon the mortality rates, based upon the psychological data that I have analyzed, I would feel very comfortable with my daughter visiting any of the physicians in the Portland metropolitan area without my knowledge. And I would much prefer, as sad as I would be to see that happen, I would much prefer that my daughter was in the care of Dr. Newhall or one of the other physicians in the Portland metropolitan area without my knowledge than some of the alternatives that might be attractive to her in that very stressful time. So that would not be my ideal situation, and I hope and pray that that is something our family never has to face. But I hope that answers your question.
Leslie Moorhead, City Club member. This question is from Ms. Powers. But before I ask the question, first of all, I think I speak for every single person in this room to say we sympathize with what your family's been through, and we honor and admire the strength that you've shown us today in telling that story. But as a spokesperson for the Yes on Measure 43 committee, in the role that you're playing there, I want to ask you this question. I'm concerned that people who will vote for Measure 43 will vote for it because they think this is a parental consent notification, rather than simply a notification that then would allow the girl, depending on her personality and her strength and her support system, she might still go ahead and have the abortion, which may have ramifications, of course, in the family. What is your committee doing to make the distinction to people who support and will likely vote for Measure 43, make the distinction between this is not a parental consent, parental control measure, but simply a notification measure, and the girl then should have her own autonomy in making the final decision?
That's a good question. I don't know that I know the exact answer to that. I know that we are explaining the bypass mechanism, which provides a girl, if she doesn't want to tell her parents, she doesn't have to. She can stop that process and talk to an administrative law judge, and then he will determine whether or not she's mature enough and it's in the best interest for her not to tell her parents.
May I respond to that as well? Is that okay? If I might just offer you up one study that was just published by a colleague of mine in the state of Massachusetts. Shoshana Ehrlich is her name. Shoshana interviewed 26 girls in the state of Massachusetts that circumvented their law and went to the judicial bypass route that Grace is talking about. And she interviewed them in depth. And every single one of them perceived no difference to her between a consent or a notification provision. So I found that very interesting. It's very recent data, and I think it tells us something about the way a child might view that law. That for a kid, whether your parent is going to be told or your parent has to give consent may not seem like a big difference.
B.J. Seymour, City Club member. This question is for Melody Rose, but I'd be interested in other panelists' response to it. I'm not sure that this measure will even do what the proponents hope it will do. Is there, for example, anything in this measure that would prevent a girl from just going and staying with an acquaintance of hers for a few days before the abortion, knowing that her parents would get the consent, but she would then go ahead and get the abortion, and they wouldn't be there to do anything about it anyway because they wouldn't know where she was?
Well, I think there are really two questions there, ma'am, and I'll try and address both of them. The first one is about whether this proposed measure, would fulfill its intended goals. And I don't see evidence from the other states that have similar legislation. If the intended goal is better family communication, I just don't think we have the data to support that. On the second question about what happens when that certified mail goes out, I think that that's a really fascinating question about the administration of the law. Lots of things can happen there, and it also begs a question of liability. If the doctor has done his or her due diligence and set the certified mail out appropriately under the law, and it's never received, it's circumvented by a friend, lots of things can happen in the administration of that. So we're invoking the postal system in the application of this law as well. That, of course, I think leaves the physician open to potential lawsuit. And that's something we haven't talked about here, but I think it's one of the potential implications of the measure, and something that the doctor has absolutely no control of, even when they're doing due diligence under the law.
Can you hear me? Okay. My comment to that is just that it is working in 35 other states, and the bypass is working, and girls who are talking to these administrative law judges, if they don't want to tell their parents, everything I understand, they are not telling their parents. So it's a small little moment, a gap, if you will, a little pause in the process to just take that extra step to make sure that this is really what the girl wants, that she's thinking it through, and it's another adult, somebody other than the abortionist who may have a conflict of interest or may, I don't know. I think there's just another person, another adult that is looking out for these girls.
I would submit that a physician with a lot of experience doing abortions and providing health care to women and delivering their babies and taking care of all their problems is much better equipped than a judge to discuss this decision with a young woman. And I don't know of a single abortion provider in the country or in the world who would consider doing an abortion on a patient who they were not convinced was clear in their decision-making process. No single procedure that I can think of, and I practice gynecology, has more counseling and more time spent with individual patients. And if a woman is not decided or unclear or ambivalent, she doesn't get an abortion. That's really the truth.
I think, Dr. Newhall, that you are a very good physician, and you see your patients for more than just abortions. There are people in this state that aren't even licensed physicians. Well, I shouldn't say that. What I want to clarify and say is I don't think there's regulation that anybody has to be a licensed physician to perform an abortion.
There absolutely is. Absolutely. And I am the medical director of an abortion clinic in addition to my private practice.
So you have to be a licensed physician?
Absolutely. Only physicians, 100%.
Okay, I didn't think there was a law in the books that reflected that.
Yes, ma'am.
I'd like to interject at this point, if I may, and offer two hopefully quick points. One is about the experience in the judicial bypass procedure. This new study that's recently released about Massachusetts girls, all 26 of these girls who went through the judicial bypass procedure reported that there was no substantive value to them at all in seeing someone from the judiciary. So they did not receive any additional counseling. They didn't receive moral or psychological support. What they went there for was an up or down decision about their request. So I don't think that there's much evidence to suggest that the judicial bypass system provides an added value to the girl. If that's what we're really concerned about, I don't see that there's evidence that that is provided. And secondly, I'm curious about the phrase conflict of interest. This is, I think, the $64,000 question about these laws, and it's the kind of the elephant in the room and nobody wants to ask. Are the abortion providers in this for the money? Are they protecting their own job security in opposing this measure? And I'll give you one, hopefully quick answer. An abortion in downtown Portland with Ruth Barnett in 1918 cost $85. An abortion in downtown Portland today with Dr. Newhall costs $400. So there is no way in which one can argue that there is a fiduciary incentive to practicing this kind of medicine. Dr. Newhall would do well to get a gig in some other form of medicine if she's in it for the money. And furthermore, I know that she has worn a bulletproof vest to work on more than one occasion and has been the subject of enormous and substantial threats of violence. So I personally, in the record of physicians in Oregon and nationwide, I don't see what's in it for them other than the protection of their patients.
Do you have something more? I'm sorry to say we're out of time. Let's thank our panel. This was really terrific. And I'd like to thank all the members of the City Club and their guests for being here today, for our TV and radio audience for their interest in City Club, and we are adjourned.